Everyone, welcome to another video with Vanessa. So in the previous videos we've been treating different kinds of cancers. We've done cervical cancer, we've done lung cancer, esophageal cancer, and today we're going to be looking at throat cancer. So throat cancer is a cancer that develops in the throat, also called the pharynx, or in the nearby structures such as the voice box, also known as the larynx, and the tonsils. So it occurs when the cells in these areas, they grow abnormally. The same with every other type of cancer, due to abnormal growing cells. So when these cells grow abnormally and uncontrollably, forming a tumor, that's when we have throat cancer. So throat cancer is part of a broader group of cancers called head and neck cancers, and is often associated with smoking, alcohol use, and infection with human papillomavirus, which also causes cervical cancer. So throat cancer is not as common as lung or breast cancer, but it can be aggressive and life-threatening if not diagnosed early. So it mostly affects adults over the age of 50, and it is more common in men compared to women. So these are the different areas in the throat where the cancer can start. Number one, it can start in the nasopharynx. The nasopharynx is the upper part of the throat behind the nose. It can start in the oropharynx. The oropharynx is the middle part of the throat, including the back of the tongue, the soft palate, and the tonsils. Then we have the hypopharynx. The hypopharynx is the lower part of the throat, just above the voice box. Then there's the larynx, which is the voice box, which contains the vocal cords that helps a person to speak. So for the causes and the risk factors of throat cancer, it usually develops after long-term exposure to substances or infections that damage the lining of the throat. So the common risk factors, we have cigarette smoking, excessive alcohol use, infection with human papillomavirus, HPV, especially the types that are linked to oropharyngeal cancer. Then infection with Epstein-Barr virus, which is linked to cancer of the nasopharynx. Then having a poor oral hygiene, chewing tobacco or betel nuts, having a diet low in fruits and vegetables, exposure to asbestos or harmful industrial chemicals. Then having a family history of head and neck cancer, because like I said in the beginning, throat cancer is like a subsidiary among this head and neck cancer group. So to understand this throat cancer, we have to look at the anatomy of the throat itself. So the throat, that is the pharynx, is a muscular tube that connects the nose and mouth to the esophagus and windpipe. So it serves both the digestive and respiratory systems by carrying food to the stomach and air to the lungs. That's why it's easy for us when we are eating and we are talking at the same time. It's easy for us to like choke, because the throat has two pathways. So one leads to the stomach, one leads to the airways, and we choke when it goes to the wrong part. So the larynx, the voice box, is located below the pharynx, and it contains the vocal cords which vibrate to produce sounds. So these structures, they are lined with thin moist tissue called the mucosa, which is where cancer usually starts. So tumors can grow and invade nearby tissues, nerves, or lymph nodes, and it may even spread to distant organs like the lungs. So throat cancer develops in the following ways. So first, there's long-term exposure to irritants or infections, causing causing damage to the DNA of the throat cells. Then we have genetic mutations that occur, causing the cells to grow without control and avoid natural cell death, known as apoptosis. Then a tumor forms which may block the airways or the swallowing passage, and it invades nearby tissues such as the lymph nodes, the nerves, or the bones, and it spreads through the bloodstream or the lymphatic system to distant organs. So for the symptoms, the early stage throat cancers they may have no noticeable symptoms, but as the tumor grows, signs will start developing, like having persistent sore throats, then hoarseness of your voice, or having voice changes that last more than 2 to 3 weeks, then difficulty swallowing, pain when swallowing, having a lump in the neck, chronic cough, ear pain, which is a referred pain from the throat, because the blood vessels that supply the throat is kind of connected to the ear and the nose and everything. So ear pain can be a symptom. Then unexplained weight loss, having a bad breath, and coughing up blood. So for the diagnosis involves a detailed evaluation to confirm the presence of cancer and determine the extent of the cancer. So there's the physical examination that is done by the doctor, including checking the person's throat, the mouth, and the neck. Then endoscopy, which is when a flexible camera tube is inserted through the nose or mouth to visualize the throat and the voice box. Then biopsy. So tissue is removed from the throat and is examined under a microscope to confirm if it's a cancerous cell. Then imaging tests can be done, like CT scans, which shows the size and the location of the tumor. Then MRI scans, which offers detailed imaging of the soft tissues. Then also PET scans, which checks for if the cancer has spread to distant organs. Then for the treatment depends on the location and the size of the tumor, whether the cancer has spread, and if the patient's general health, and if the patient can tolerate the treatment based on their health condition. So first we have to look at the surgery option. So the tumor removal may include part of the throat or larynx in the early stages, or the entire voice box in advanced laryngeal cancer. Then the nearby lymph nodes may also be removed. Then radiation therapy, where we use high energy beams to destroy the cancer cells, and it can be used alone or after surgery to reduce the recurrence. Then chemotherapy, whereby you use the drugs to kill the cancer cells or to shrink the tumors, and is often combined with radiation for better effects. Then targeted therapy, which blocks specific proteins in the cancer cells, and it may be used to treat certain types of throat cancers. Then immunotherapy too can be used. So for the management of this throat cancer, it's good that these patients have nutrition support, because they have difficulty swallowing and they have mouth sores, which may affect eating or make eating difficult. Then they should also get speech and swallowing therapy, especially after surgery or radiation that is done to the voice box. Then for pain management, you can give pain medications to give for them to feel more comfortable, and you can also give psychological support. And then rehabilitation, which helps the patient adjust to changes in the voice or in changes of their eating patterns based on the stage of the throat cancer that they have. Then also encourage the patient to do regular follow-up, to monitor for, even if the person has had a surgery whereby they removed the part of the throat cells that was causing the cancer. It's good to have a regular follow-up, because there can be possibility of reoccurrence. So to monitor for this reoccurrence and to monitor for complications after the treatment. It's good to have this regular follow-up. So basically, in summary, throat cancer is a group of cancers that affect the throat, the voice box, or the tonsils, and is commonly linked to smoking, alcohol, and the human papilloma virus. And symptoms include the hoarseness of the voice, sore throat, difficulty swallowing, and then diagnosis like endoscopy, biopsy, and imaging tests like MRI, CT. Treatment is the same for every other cancer, like surgery, radiation, chemotherapy, and also newer options like immunotherapy. So that is it for this video. Thank you for watching. I'll see you in the next video. Bye.